And so every week we are here and you're giving us an update and you're back. Marcos Mejia from the county of Sonoma. Welcome once again. Tell us what's going on with the county. We know that there are changes with the mask mandate, and we don't know how that's going to affect the community. But what information do you have for us today?
Well, let me begin with some important news. This is a milestone. We have reached the 80% of the county's eligible population as fully vaccinated, which means they have either the Moderna or Pfizer series of 2 doses, or they went for the Johnson & Johnson with 1 shot. That is fully vaccinated. And they are 80% now, the vast majority of the county. That means that 1 out of 5 persons in the county is fully vaccinated. That's a great thing. Also, next Monday or Tuesday, that's our expectation that we're going to be celebrating another important milestone, which is 1 million doses supply, since this campaign began 14 months ago. So we are reaching that 1 million milestone. That's another big step into protection against COVID. And additionally, we have almost 63% of the eligible population. So far as 12 and onwards, or 12 and older, they have a booster too. So all this front with vaccination creates a great base of immunity achieved through vaccinations. We also have another base of immunity through the infections that the wave of Omicron caused locally and around the world too. So all this combined give us a good chance to continue seeing the numbers lowering, because all this base of immunity gives less opportunities to the virus to replicate or to infect other people. We are going to continue insisting that people get vaccinated and boosted, because we're seeing that people who's fully vaccinated still is getting infected with Omicron. And it wasn't the case before Omicron, you know. With Delta, we saw that lightly with the original versions and the first variants. People fully vaccinated was not getting infected. With Omicron, it's not the same story. The big difference is that the vaccinated people tends to be asymptomatic, which means no symptoms, or suffer very minor symptoms. Now, the responsibility part here comes when this group of people, fully vaccinated or even with a boosted, if you get exposed to public because you went to a party or a bar, or you attended a concert, or you have you had to travel and spend hours in a crowded airport and airplane, then the best thing you can do is get tested. Now, tests are very accessible. You can be reimbursed if you have health insurance for 8 tests monthly, which allows you to test twice a week. So it's easy to detect the virus, and that way is your contribution for the rest of the society, because we could be spreading COVID, not even knowing. So that is an important. So with all this base, we still have 13% of people that has not been vaccinated. Most of this group are the kids that are not eligible yet. That's under 5, and those 5 and onwards who are still at 34%, somewhere there, that are fully vaccinated. And we see that we began really strong in November with these vaccinations, but that first wave of people that is really looking forward for the vaccines, probably they all of them did it now, and now we have this block of people that is hesitant about the vaccine. So my invitation for them is that talk to your pediatrician, talk to other parents, and help us advance this front of vaccination and immunity, so we can get this pandemic behind us, hopefully sooner than later. We keep celebrating this mark also of almost 63 of people that have received boosters, and it's important to remind the audience, the listeners, that boosters provide protection against the worst of COVID, which is severe illness, hospitalizations, and deaths. Our case rates continue dropping. This week we have almost 47 cases, for every 100,000 persons that live in the county. This measure is taken every 7 days, and this is a good trend because this speaks of a lower spread of the virus. It was moderate, it was sustained, but now is leaning towards moderate. So that can give us more freedom to be around and not use masks. Well, talking about masks, let me tell you that starting yesterday, the county of Sonoma, in alignment with the states and joining another 11 counties and the city of Berkeley, they decided to leave the mandate to wear a mask. So that has been lifted, and this applies for the persons that are fully vaccinated, starting yesterday on February 16. So fully vaccinated people now have the option to mask or not in crowded spaces. With all what I said before, we are recommending that people keep wearing the masks in public places, at the interior public places, so they can protect others. It's an option now, and it's going to depend also in different factors that I'm going to mention. Unvaccinated individuals over age 2 will continue to be required to wear masks in all indoor public settings. Now, business and venue operators and hosts may determine their own paths forward to protect staff and patrons, and may choose to require all patrons to wear masks. Indoor masking is still required by the state for everyone, regardless of vaccinations of status, in different settings like this, in public transportation, in healthcare settings, hospitals, clinics, in congregate settings such as correctional facilities and homeless shelters, long-term care facilities, and in K-12 schools and childcare settings. I strongly want to recommend people who face the greatest risk of illness are seniors, essential workers, and people with underlying conditions, and the people who care about them to continue to wear their mask indoors in public settings. While wearing a mask indoors is no longer mandatory for people who are vaccinated, still it remains a smart and a simple way to protect yourself and the people around you. Now, regarding the schools, there's been a lot of tension with masking or masking the kids. There are the two trends are strong, the ones that support it and the ones that oppose it. So the state is going to reassess indoor mask mandate for schools on February 28th. California will keep its indoor mask mandate. This is a state order for K-12 schools in place at least through the end of this month. This is what the state's top official said on Monday. Even if relaxed face covering rules is in other settings today, the schools remain wearing masks. California will reassess condition on February 28 to see whether the promising trajectory of the pandemic continues. This is what Dr. Margali, the state's health and human services secretary, mentioned. He said that if the pandemic outlooks continue to improve during the next 2 weeks, the state will likely use the firm date for when the school masking requirement will move to a recommendation. So we have to wait and see what's going on with the schools until the 28th. He noted that California has just had 1% of COVID-related schools closures in the nation, despite having 12% of the U.S. school children. So in general, we're in a favorable place. So with these trends that I mentioned at the beginning of my talk today, if we see numbers dropping, they continue to drop, chances are that we get there, but I don't want to anticipate. Let's wait and see. It is important to note that the state of California has authority over schools when it comes to masking and not individual counties. So in this, we have to align with the mandate from the county. I mentioned also that the number of cases continues dropping. There are 57 people in the hospitals as of Tuesdays, and 8 of them are COVID patients that are in the ICU. And finally, I want to talk about the emergency rental assistance program, which has been paused I made this comment last week, or maybe you did it, because I think I didn't do that part last week, but it has been in a post. There are 4,000 applications that are still being processed. 25 millions have been dispensed to 2,100 households throughout the county. So this is benefiting a lot of people. There, all of these applications, 4,000, will be processed, and hopefully most of them are approved. Many of them started happening late October last year because of the possibility for these people, for these applicants, to be protected against eviction. So we expect that the original close to $40 million assigned for this program, I mentioned that 25 million have been already applied. So the difference of that is going to be assigned among all of those applications that are approved. So, well, lastly, I'd like to mention that there is one more weekend chance to go to obtain vaccinations at the fairgrounds in the Garrett building. There's this is the last weekend for the clinic. That is from 9 a.m. to 4 p.m. and it doesn't require to make an appointment. There are first doses, second doses, boosters, and there's also the chance to test through our partner LHI. They are there from 7 a.m. to 7 p.m. So this is going to be the last weekend. So if you have the chance and you need it, the entire family can go there. The vaccine is for free. They don't ask for your immigration status, or you don't have to have an insurance, health insurance. And that's my report for today, Rafael.
I do appreciate that again, and just reminding the community that on Saturday, from the 19th, from 10 a.m. until noon, we are going to be at 1260 North Dutton in Santa Rosa. We are going to be giving out masks. This is the Latinx Student Congress, Humanidad Therapy and Educational Services, and Líderes del Futuro. We receive about 20,000 masks. We gave thousands of them last week. We took some to places of worship, and people came and received some. So again, we're going to be doing that again, 10 to 12 this Saturday, the 19th, and probably we'll give all of them away. And with that, I want to thank you as always for taking the time, and I look forward to our next conversation.
Thank you very much. I'll see you next week, and have a good weekend.
You too. Bye-bye.
Thanks. Bye.